Welcome to Issues and Answers with your host, Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. Why am I smiling so broadly? Because I'm telling you and my guest and the studio crew here that today is day one for me. Day one. Of course, I've said this in the past, but I'm saying it now to everybody. Day one is starting to take better care of my health, and I've learned that food is medicine, and I've learned that stretching and moving and getting active is taking care of our lives. And on my show today, the treat is Dr. Patrick Nuzzo. He is the founder of Southwest University of Naturopathic Medicine. He's going to share some fabulous tips. I don't know if I should say it, but to help save our lives. Is that too much, Dr. Nuzzo, to say that? You decide.
Keep life going longer.
Keep life going longer.
There you go. Healthy.
Healthy life, a vibrant life. So stay with us, grab that piece of paper and pencil, or if you use your cell phone to put all your notes in, get ready because we have some fabulous tips about how we can keep our life going better and longer and being happier. Stay with us as we talk to Dr. Patrick Nuzzo right after this.
Hey America, now there's a place where we can join our voice, Real America's Voice. Real America's Voice is coming to a town near you with a grassroots approach, bringing the real voice of America together. Real America's Voice is growing our family of networks across the country, and soon you could be part of that change. Download the Real America's Voice app and join other Americans just like you across the country, coming together for real.
If you're like me, we have pain. We have pain in our lives from our kids usually, from our relatives, right? Is that true? We have some pain and a lot of us turn to our belief in God and do prayer, but also there's a belief that we can help ourselves by taking care of ourselves, taking care of our health. And on the show today, we're going to talk to Dr. Patrick Nuzzo, who is going to talk about manual therapy. And if we get out of alignment, if we don't do what we're supposed to be doing here on day one, he's going to share the belief that we can take care of ourselves, we can go to see a naturopathic, a manual therapist, and we don't have to take drugs to cure those pains that we have in our lives. And we don't have to take diet soda, that's what he says. That is poisonous, it's cancer causing. It brings me some joy, but starting today, day one, as I'm saying here to you, I'm going to be cutting that out. Dr. Patrick Nuzzo, you're laughing, and you know it's not easy.
It's not easy. I have great compassion for it because it's, there's food additives in that. There's addictive properties to these synthetic foods, right?
Synthetic foods.
Synthetic foods.
And let's start with, we're going to talk about manual therapy and all that, but talk with the diet. I mean, we take these diet foods, diet sodas, and we think we're doing some good because it says diet in it.
Right.
But how much poison can we have in our bodies?
Well, I mean, it's all over the charts. Artificial sweeteners have been knocked for years. I mean, just last week the World Health Organization came out and made the definitive call that it is cancer causing. And of course, all the trade organizations came out and said, well, you need to have 20 cans a day or 12 cans a day. How much poison is good? 1 can, 20 cans? I mean, you really have to take charge of your life, all right? Food is medicine. I've been a blessed man, okay, because I was taught that lesson early in life. I'm a naturopathic physician. I had the blessing of growing up in a family where my uncle was a naturopath. My uncle studied with the founder of naturopathic medicine. So when I didn't feel good as a child, I went to my uncle for a treatment. That's the doctor I knew, right? So I had upset stomach, I had headaches, or, I went to Uncle Joe, he gave me a treatment, he'd recommend herbs, he'd tell me what to eat, what not to eat. He was just a huge influence on my life, right? So I believe food is medicine. And Diane, I'm gonna be 70 years old this year, okay, at the end of this year. I could work circles around anybody I'm around. I'm going to be a naturopath for 40 years this year.
Oh, wow.
Okay.
4 years.
40.
Wow.
Yeah. October of this year, I would have graduated 40 years ago. I've never been on a prescription medication in my life. If I don't feel good, I know what to eat, or I'll find out what to eat, or I'll find out what not to eat. You can take care of yourself. And people, need to seek it out. It's here. I mean, we have to live, what type of diet do you eat? People ask me. Well, my diet is, I eat food that is medicine. I find the highest quality food, whether it's meat, whether it's fish, whether it's chicken, whether it's vegetables. I eat food that is grown organically on restored regenerative soils that has nutrients still in it that we can then get and build our bodies with.
Where do you find that kind of food?
Oh, it's everywhere now. You could find it in all the grocery stores. I mean, organic food is everywhere. Grass-fed meat is everywhere. You could find it in the major grocery stores. You can go to the health food stores. You have, farmers that are selling, their wares at farmers markets, right? The food to table movement is hugely important. The regenerative soil movement is hugely important because we have to take care of the soils, right? If you go out there right now, they say that 40% of our topsoil is gone in the United States, and it's totally denatured, right? There is no minerals left in it because it's pesticides, fertilizers. They grow these crops, for yield, not for health.
For yield, not for health. But fertilizer, does that have the chemicals in it that we need?
Fertilizers has chemicals to suppress, to get the growing
right.
Get the most out of the plants, provides the nitrogens, and then the pesticides they spray.
Right.
It's not just about the foods; it's about what is it doing to the soil, right? You got to regenerate soil. The old ranchers, the old farmers, they used to rotate their crops. They would take their cattle and they would graze them on different parts, and the cattle would go and they'd do their business, they'd eat their food, they'd drop their excrements, and the soil is regenerated. And we need to do that to capture carbon, right? To get a natural eco balance in the earth again. And we've got a long way to go, but it's possible.
And you believe in organic food has it?
Well, organic food, if it's really grown by organic standards, it's grown in soils that are restored and regenerative. They're not using pesticides. They're not using fertilizers. They're using natural methods of growing. And that food has got the nutrients in it that come up out of the ground, if that ground is tended, that come into our bodies and feed us. If we are the most overfed and undernourished country in the world. There's no question about it. We are caloric high and quality low.
No nutrients in what the calories we're eating.
If you're eating the commercial diet, what some people call the standard American diet, which is sad, right? You eat fast foods that are, not prepared, with care. They're not, grown in soils restored and regenerative. They're not organic. You're eating foods that are not.
Do you suggest people take vitamins? Do they need vitamins if they're eating?
If they're eating properly, if they're eating food that is medicine, you're not having to take vitamins because you're getting that nutrient out. Now, if there's a deficiency, if somebody, everybody can't be in perfect health, right? When you're coming through this process of making food medicine, you're going to probably need some help. You might need some supplementation, some specific supplementation, some specific herbs or some specific foods to build organ systems again. You got to get your flora going again. The human, genome, the gut flora is really, really, really important.
Can we find all of this in your book? You handed me your book, Anti-Inflammatory Medicine, Naturopathy, and Nutrition for a Healthy Regenerative Lifestyle.
There you go, Diane.
Is it all in here? I could just read this and not talk to you about it. It's in here.
There's a lot of good guidance in there. I mean, it's not all in there. I've got 70 years of experience.
You've written other books.
I've written, one other book, and it's on, and this is actually just an extension of the first book, right? Because we've added we believe in anti-inflammatory medicine, okay? We come about it manually, right? Hands-on, and we come about it metabolically, right? If you
wait, what's metabolically?
Metabolically, food. right? We come about it manually by treating the body, by finding where the tension is, by releasing that tension, by aligning bony structure, okay? And then we come about it metabolically by recommending, food is medicine, drink water, eat the foods that are grown in these soils, seek it out, change your diet over, eat grass-fed, pasture-raised meats, eat pasture-raised, chickens, and, support the farmers and ranchers that are out there curing the soil, right? They're out there tending to the soil and making it come back. And they're doing that by providing foods that are bringing us health, right?
And that'll keep us healthy. And if we stretch and exercise in the morning, supposedly we don't need to have this manual therapy that you do, but in some cases, we're not stretching, we're not getting nutrients, we're not drinking enough water, then we need to see a hands-on manual therapist such as yourself, a manual doctor, naturopath.
Yeah, I mean,
we talked about our other show, and if we're out of alignment, you're going to show us what does a naturopath do.
Okay.
Because if you go to your primary care, sometimes they just write a prescription.
Right.
I mean,
right.
That's
right.
They don't really touch you, do they?
Well,
primary
it's,
care, if you go there, I think it's the number 2 and 3 reason is going
back
to see
pain and
back
joint pain, right? So to go to a medical doctor for back pain and joint pain, you run the risk of getting a prescription medication, more than likely getting a prescription medication to mask the symptom that you walked in there with, right? You got pain, let's give you something to take care of the pain. You're treating the symptom, not the cause. Manual therapies, naturopathic medicine treats the cause of pain and inflammation, which is malalignment of the bony structure.
Give us an example of what you do.
All right, so everything comes off the body, off the spine in bundles, neurovascular bundles. Nerve, lymph, blood come off the spine, go to all the different parts of the body. They bring food, they bring blood, they bring oxygen, they bring waste away. It's a system that works, right? You've got to get that system working properly. So if somebody comes to me with, you said sacroiliac pain, right?
Actually, my brother supposedly has that.
Okay.
But he's having sacroiliac is...
So it's where the sacrum, the bottom of the spine, and the ilium, the hip bone, meet, and they form a V joint at the bottom of the spine. And that bottom of the spine where the sacrum and the ilium come together is a sacroiliac joint. And that joint is bound together by ligaments. It's a sliding joint. It's not like a ball and socket joint like the hip or a rotating joint like the shoulder. It's a sliding joint, okay? And it's a V joint. So with somebody with sacroiliac, it's sleeping positions, sitting positions, old injuries. We go in there, we get them face down on a table. We'll take topographical findings to see how the hips are aligned, to see which way the legs are going, and we treat according to those findings to counteract the tension that is being held in place. And when you have tension in the ligaments, the muscles then, they compensate for the tension in the ligaments. The fascia compensates for the tension in the ligaments. And we have malalignments, right? So somebody like that is probably going to need more than just stretching and hydration, right? Now, once you get to the place where you have fascia and ligaments pulling bony structure out of alignment, stretching will help. And if they come in for a treatment, their regimen at home is you're going to have to stretch and you're going to have to do this regularly, daily. You're going to have to hydrate regularly, daily. So you're getting the tissue hydrated again so we can get it back into alignment. So it's manual, hands-on treatment to the areas that are out of alignment.
And you're able to get in there, the sacroiliac joint. I looked online, it looks like it's just a bone.
Well, it's very deep, but you're treating through the skin, through the musculature. So you're taking tension findings all along that bony structure. You're finding what's anterior, what's posterior. Based on those findings, you're then doing manual manipulation to bring that bony structure back into alignment. Now, we don't do a high velocity force movement. We pull and treat the tissues that pulling that bony structure out of alignment, unlike chiropractic, right? If you go to a chiropractic, they'll treat sacroiliac pain, but they'll usually do that with more high velocity. They'll adjust the low back. They'll do rolls. They'll try and get that vertebrae to move, right? And that's all good. That's what we try to do too, but we do it by treating the tissue that's pulling it out of alignment, not forcing it back into alignment.
Because if it's forced back in, it could just come back out again, unless.
Pretty much.
To my mind, it sounds like you have to strengthen those
You've
ligaments.
got to release the tension and then let them get strengthened. Let them hydrate again, because
And get back. Okay.
when tissue is pulling out of alignment, it's like a wash rag, right? It twists. So when it twists, it shortens. And when it shortens, it's not getting its nutrient to it. It's not getting blood flow to it. It's not getting
Oftentimes,
nerve
doctors
flow to
for
it.
pain want to give, what is it called? The shots.
Cortisone.
Cortisone shots.
Yeah.
For the sacroiliac. What does that do?
It numbs.
Just
It numbs the pain.
Oh, it,
You know, it's not releasing tension. It's going into an area to release the pain and release the inflammation. I mean, it's an anti-inflammatory. It's a very potent anti-inflammatory medication, but it's injected right into the spot. But that's where it hurts. That's not what's pulling it out of alignment to make it hurt there. So you get an injection, and really all it does is break down tissue. It weakens tissue. So if you go into that ligamentous tissue and you shoot steroids into it, you weaken the tissue. And sooner or later, that hip's going to break down. And sooner or later, you know, if it keeps on going down that pathway, we're going to start getting some bone on bone. And sooner or later, you're going to have to get a $40,000 hip replacement, you know. And if you would spend some time and a little bit of money and the healthcare system, right? They need to know that these hip surgeries and these knee surgeries and these ankle surgeries caught early can be eliminated, not necessary, right? I mean, we've had hundreds and hundreds of patients over the years that, you know, I've got to go get a hip surgery, but they're still walking, they're still functioning, they're still, well, why don't you start doing something about it now so you don't have to get hip surgery? Why are you taking that, planting that seed and say, well, I got to get hip surgery in 10 years, you know, why? Why don't you take care of yourself? Why don't you rebuild that tissue? Everything you put in your body, okay, builds new tissue. 7 years from today, okay, every cell in my body will be new. 7 years, every cell in my body, every cell in your body will be new. If you eat a really healthy food as medicine diet, guess how much better you'll be in 7 years than if you go down this standard American diet and eat this food that's, you know, just
poison.
void of any
What I eat maybe is the
nutrition.
poison.
Well, don't say that. I don't believe
What
that. Sometimes you probably take some foods in that are not good, but I know you, Diane. You eat a good diet, you know, and that's what people have to do. You got to make a commitment of it.
Make a commitment, and I'm verbalizing my commitment. And I put it in writing as well.
I'm
and
sure
not happy about it.
there's support groups out there, Diane, for this.
There should be.
There is. I'm sure
should
there
be.
is. I'm
And we
sure
see
there
all
is.
the diets.
Yeah.
There are all
Yeah.
these special
Yeah.
diets and
Yeah.
things. Regarding neuromuscular pain and injuries, I looked online. There's ALS, Lou Gehrig disease. There's what other?
Well, those are the chronic diseases, the degenerative diseases of the neuromusculoskeletal system, right? I mean, that's an
Muscular dystrophy.
That's all extensions. MS, you know, multiple
Yeah.
sclerosis. Those are all diseases of the vascular system, neuromusculoskeletal system, right?
Right.
And you again, I mean, you could treat the body, right? Even I get all kinds of people coming to me with Parkinson's, right? Parkinson's is another one. And Parkinson's I hate to say it, but it's self-induced. You know, it's diet related.
Parkinson's is when they begin.
Yeah, but
I think
the tremors.
The tremors,
right? But you know, it's either exposure to chemicals, you know, bad exposures to environmental stuff, horrible foods, not eating the right diets. You know, there is a diet component to every disease, cancer, heart disease. It's all there. We self-induce most of this stuff. You know, because we're eating foods that are not taking care of our system, right? And people have to realize that it makes a difference.
But this neuromuscular pain and injuries can be treated with manual therapy.
Absolutely.
With naturopathy, but
Absolutely. Will they reverse them? Depending upon the severity, most likely no. You know, I mean, if you're at a degenerative stage of disease, what you want to do is you want to treat this early on so you don't go from acute to chronic, to degenerative, right? So they're in a degenerative state of disease. You got to intervene somewhere along the way, right? When you get somebody that far, like somebody, unfortunately, they come with fourth stage cancer, then they want to do everything. They want to come and change their diet. They want to. It's too late.
So they do come,
lots of times.
Dr. Nuzzo, they do come to you with concerns about Parkinson's, muscular dystrophy, Lou Gehrig.
Well, if they're starting, like if they start getting symptoms, like they're starting to get diagnosed, that's when you need to really start putting the foot on the gas and starting to take care of yourself. Because all you have in medicine is medicine, right? They're not going to treat the cause. They're going to treat the symptoms. And the symptoms are going to get you, treating the symptoms are going to get you sicker and sicker and sicker and sicker.
But going to manual therapy.
Likely you can get some improvement. It's not going to happen with everybody, but you're taking care of yourself. You're eating better. You're going to have a better quality of life, right? And some people can reverse it. Some people, it's the commitment level. It's not the doctor,
Good. Say that. Repeat that. It's not the doctor.
It's the commitment level. I could advise you every day, but if you don't do it, am I a quack? Am I not right? It's how you do it. So people who come to integrative practitioners like us have to want to take charge of their health. They're not going to come and get a pill. We're not going to take care of them. We become partners in their health care. We teach them.
Not a quick fix.
It's a lifestyle change. You got to live this. You don't have to see me all the time, but I'm a part of your journey, right? I'm a part of the journey. Here, you'll learn something. You go see other practitioners. You start doing yoga. You start hiking. You start eating better. You start buying good water. You start just upgrading your lifestyle. Food is medicine, Diane. It's that simple. Eat the foods that heal you. Eat the foods that heal the planet.
Where can we find your book, Anti-Inflammatory?
Amazon. Yeah.
Any other tips in here that you can share?
It talks all about, just what we're talking about, the microbiome, getting the gut right, getting your, making sure that you're digesting food, that you're eliminating food every day. There's not many people who could say that I have a bowel movement every day, right? That's a normal function of life. You got to get that going again. And you can do it by diet, by eating properly, by drinking water, get on Google. Google's an amazing tool. There's so much information out there that you could learn about taking care of yourself, And it's just that important. But it's got to come here. You got to make that decision.
Do you suggest people watching this program who have never gone to a naturopath or someone with manual medicine, just do a routine checkup? Tell me about routine checkups.
Diane, do you know anybody without pain? Do you know anybody that doesn't have a knee pain or a joint pain or a neck pain or, I crochet, it's repetitive motion too, Any of those people could be helped by manual therapy, because what we do is we increase circulation, decrease inflammation. And we do that, it's like the body has, everything flows in the body in what we call neurovascular bundles, nerve, lymph, blood, right? They team up together, they move throughout the body, and it's a bundle, right? If you have muscular tension around that bundle, it's like stepping on the garden hose, right? Water doesn't come through real well on the other side. So if you have diminished circulation going to glands, organs, tissues, hips, knees, right? You have diminished circulation, inflammation goes, toxins build up, pain builds up, right? So as a naturopath, we go in and we open up the flow. We treat the body to make sure, it's like cleaning out the gutters, right? The gutters don't drain. Right.
We need rain.
We need rain.
So and what's interesting, you start kind of at the neck?
It's a full body treatment. You concentrate on the areas of complaint. So when a person comes in our office, they're fully clothed, face down, take findings, fully clothed, face down, take findings on the body, treat into what we're finding, concentrate on their complaints, turn them over, do the neck, do the shoulders, stretch the legs, because everything is connected. Everything is connected. The knee bone's connected to the hip bone, that song, something like that. But everybody could benefit from a hands-on manual therapy. Everybody.
If they live in a state in here in New Mexico, you're licensed here.
Right.
It's licensed in Illinois, and now, thanks to you and your efforts, in Nevada.
Yeah.
If they don't live in a state where there's license, what are those
For now, well, I mean,
do?
there's massage therapists, there's acupuncturists, there's chiropractors, they're manual therapists, you find somebody who's competent out there and
But we're lucky to have you in New Mexico.
Yeah.
Where do we find you in New Mexico?
Well, we have offices in Albuquerque, Santa Fe, and Los Alamos. Our website is sunm.edu. You can get on the website and kind of take a look at the treatments. There's all kinds of videos out there. There's example treatments that are videoed up there. There are a lot of them that I'm doing. And there's a real education. And, we have a school, right? We've got a first accredited naturopathic school in the country here in Santa Fe, New Mexico. Well, I'm in Albuquerque right now, but here in New Mexico. And, we're educating, we've graduated 50 naturopaths, Diane.
50.
That are all working in New Mexico, providing care to New Mexican citizens, paying grocery receipts, taxes, taking care of the citizens in New Mexico.
And I think here in Albuquerque you have a special clinic.
We have our clinic here in Albuquerque off of Jefferson in Wyoming, and a lot of our graduates have clinics down here. One of our graduates, Dr. Bo Hightower, is an influencer on the internet. He's got 1.5 million followers on YouTube, and we did a video about 10 months ago and why he left chiropractic for nephropathy.
And if they want to find more, we can go to your website.
Yep.
Which is almost like Sun Broadcasting, but it's SUNM, which is again Southwest University Naturopathic Medicine. So it's not New Mexico.
.edu.
.edu, that's easy. SUNM.edu. They can look at another program that we did before with you. But if not, we have the book.
Yep.
And you can go online.
And any questions, call. We got great staff. We've got 9 doctors and 5 interns working in our clinics. So, there's
So kind of no excuse.
No excuse.
No excuse for pain. No excuse for taking those.
Try something different. Try hands-on manual instead of taking a prescription medication or an over-the-counter medication.
Very good, Doctor. Dr. Patrick Nuzzo is my guest. This is day 1. Good luck to you and to me. We'll see you next time. Bye-bye.
The New Mexico Modern Child Support Family Program works to benefit both parents for the purpose of improving children's lives. It provides the basics of child support, but goes further by helping parents step up to find better job opportunities that get them back on track to paying their monthly child support obligation. Find out how the Child Support Step Up program can help your modern family. Contact New Mexico Child Support today to learn more.
Issues and Answers with your host Diane Kinnewater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program or to purchase a copy of any Issues and Answers program, visit sunbroadcasting.org or call us at 505-345-1991.